My name is Dr. Shari Barkin. I am honored to serve as the committee's chair. I'm a professor of pediatrics at Vanderbilt University School of Medicine and conduct longitudinal randomized controlled trials examining how to prevent childhood obesity in family-based, community-centered ways. Just would like to, as my presentation is coming up, I would like to thank all of you for making time to be here today and to share your expertise with the committee. What I'd like to do is to just prime the pump as we're getting started today. And to do that, I want to root you in our statement of task and what the committee has been asked to do and what our workshop objectives are today. So we really are a committee looking at obesity prevalence and trends and understanding how to best extract meaning from data. So for example, you will hear all of these things in the news, like more than 2 in 3 adults are considered to be overweight or obese. And you might have heard that more than 1 in 3 adults are considered to be obese. You might have also heard that more than 1 in 20 adults are considered to have extreme obesity. Or perhaps you've heard that about 1/3 of children and adolescents ages 6 to 19 are considered to be overweight or obese. Or you might have heard the statistics in another way. More than 1 in 6 children and adolescents ages 6 to 19 are considered to be obese. And in fact, you can pull many statistics when you are doing your research. And yet our question today is, from where do the data derive? What are the methods that are applied? What are the analytic considerations? What could they or should they be? And how does that then translate into our interpretation of data, how we get to meaning? So just as an example, a snapshot of a subgroup analysis. During 2009 to 2010, the prevalence of obesity was 12.1% among U.S. children aged 2 to 5 years, with higher rates among some subgroups, including non-Hispanic, Black and Hispanic children. And this is from the NHANES data. And I am at Vanderbilt. I'm in Tennessee. This study prompted the question from me, what do Colorado, Pennsylvania, and Tennessee have in common? Any thoughts? Often you do not see these 3 states clustered. Well, from this particular study, it's that those were the only 3 states where there was an increase in obesity prevalence for children ages 2 to 5. This was from PEDNES state public health surveillance data that looked at low-income children birth to 4 years, many of whom were WIC participants. But I'd like you to see that while we state these things often as absolute fact, we do recognize that several states didn't contribute any data. We also recognize that when we say that there's an increase, a decrease, or no change, that the baseline really matters. For example, from the PEDNES data, again, for young children, you can see that while California wasn't mentioned as increasing in prevalence for young children, they actually here are shown to have greater than a 15% prevalence of obesity in young children. And so what does that mean? All young children, boys and girls different, race and ethnicity? How can we use this to better understand what it means to guide our future approaches? And this is just another way to say, what does it mean when we say increase, decrease, or stay the same? I'm focusing on Tennessee since this is where I am from. And you can see Tennessee in the blue, we were one of those 3 states that increased. And yet, how much did we increase? Well, we went from a little bit under 14% to a little bit over 14%. And then you have to ask, how does this guide us? How does this add meaning? So, our committee's task, we have several goals that are part of our task. The first is to examine methodologic approaches to data collection, analytic procedures, and interpretation of data at the national, state, and local levels on issues related to obesity in U.S. populations, and then principally focused on children. It's also to understand data sources and limitations to data gathering among different population groups, and advantages or disadvantages to approaches associated with recent reports on both prevalence, and trends. We also have been tasked to consider best approaches to evaluate differences in trends among diverse population groups, especially those at social and economic disadvantage. And then, based on a systematic methodologic approach and available evidence, to develop a framework for assessing studies on trends in obesity for policymaking and program planning purposes. Also to recommend ways decision makers and others could move forward to assess and interpret reports, and then recommend options for improving data collection and filling data gaps. This brings us to today and our workshop objectives. We have 4 objectives from today, and what you'll notice as the day evolves is that each session builds upon the prior session so that we can integrate and create an understanding as we move through how these elements fit together. So the 4 workshop objectives today that we will strive to achieve is to understand the strengths, weaknesses, and opportunities of existing data at the federal, state, and local levels to assess obesity prevalence and trends, to review key analytic and interpretation principles to ensure appropriate conclusions are drawn from obesity data, to understand the components of a framework and explore the needs of practitioners and policymakers in collecting, analyzing, and interpreting data on obesity to help inform framework development, and then to identify emerging approaches for assessing prevalence and trends in obesity. That's a lot to do. We have the right experts in the room to help provide your guidance, your expertise in the area. I want to acknowledge and thank our IOM Obesity Trends Committee members. If you are a committee member, could you just stand up for just one moment, please? We have half of our committee who's present today. I'd like to thank them. Thank you. And I also would like to thank our IOM Obesity Trends staff. Megan, will you raise your hand as well? So with that, I'd like us to get underway. The task being undertaken by this committee, which is indicated on the front of the information sheet that you all have received, is to examine these methodologic approaches. I want to note that this is an open on-the-record session, that interested individuals and members of the press have been invited to attend as observers. This is not a news conference, however, so we're not entertaining questions from the floor. Reporters who would like to talk with members of the committee are asked to touch base with Megan Quirk, who just raised her hand. And if you have any questions, you can find her during the break. I also would like to remind everyone that this is an information gathering session. That is, that the committee is in the process of assembling materials that we'll examine and we will discuss in the course of making its findings, conclusions, and recommendations. Therefore, I ask everyone here today to be mindful of the fact that the committee hasn't made any conclusions and that it would be a mistake for anyone to leave here today thinking otherwise. Comments made by individuals, including members of the committee, shouldn't be interpreted as positions of the committee or of the National Research Council. And in addition, committee members typically our goal is to ask probing questions in these information gathering sessions, but this may not be indicative of personal views. The committee deliberates thoroughly before writing the draft report, and moreover, once the draft report is written, it goes through a rigorous review by experts who are anonymous to the committee, and the committee then must respond to the review with appropriate revisions that adequately satisfy the Academies Report Review Committee and the chair of the National Research Council before it's considered an official council report. So I am concluding my public statements to say that we are really delighted that all of you have made time to share your expertise with us today. And I would like to introduce Dr. Tina Coe. Dr. Coe will be offering some opening remarks on behalf of the Robert Wood Johnson Foundation, which is the sponsor of the study. Dr. Coe, thank you.